and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today we welcome back on the show Dr. Ni-Cheng Liang. She is a pulmonary physician and she wrote the Kevin MD article, A Physician Waits in Uncertainty. She's also founder of the Mindful Healthcare Collective and she is the co-host of the Mindful Healers podcast. Ni-Cheng, welcome back to the show.
Thanks so much for having me again, Kevin.
So for those who didn't listen to your previous episodes, can you briefly introduce yourself, tell us about your practice, and then tell us about your new podcast?
Sure. I'm an adult pulmonologist practicing out of San Diego. I'm also a cancer survivor and as a result a mindfulness teacher. And having had conventional medicine save my life, it was integrative medicine approaches that helped maximize my quality of life, including to this day, including mindfulness. Our new podcast is basically about the ways mindfulness can help decrease the struggles amongst healers. It's really meant to help heal the healers using mindfulness.
And especially during the pandemic, a lot of healthcare workers are undergoing through a tremendous amount of stress. Now, what are some of the things that you've learned from a mindfulness perspective over the past year?
Over the past year, uncertainty has been a main theme of the pandemic in general. And from a mindfulness perspective, paying attention on purpose to the present moment without any judgment goes hand in hand with how human beings can deal with uncertainty. And so that's been probably the most helpful tool, is to ground myself back into the present moment experience, however uncertain the future is.
So let's talk about your most recent Kevin MD article. This was written back in November. It's titled, A Physician Waits in Uncertainty. Now, for those who didn't read the article, can you just walk my audience through it and share the story of why you decided to write it?
I decided to write it because the fact that I had to get tested because of a potential exposure or an positive COVID diagnosis came up for me, and how uncertain that was. And just sitting with the uncertainty brought up a lot. And I just wanted to highlight the realities of a day-to-day healthcare professional dealing with the uncertainties of testing. And now since then, in total, I've now been COVID tested 4 different times. And I feel like every single test has been an evolution of how the US has progressed in its efficiency of testing, as well as its accessibility and the timeliness of results. So it's been an interesting progression of medicine, really.
So tell us a little bit about that story about how you were potentially exposed to that patient. What exactly was the exposure and what happened next?
I'm usually called into the inpatient consult service. Initially, we had started off as separating the teams into non-COVID versus COVID patients. And so I was assigned, as usual, to the non-COVID service. And that was earlier on in the pandemic when the non-COVID service, quote unquote, was still primarily mostly non-COVID patients, but that has flipped since then. And so there was this patient that I had a very high index of suspicion, even though she had 2 negative PCR tests from her nasopharynx. But knowing that most of her symptoms were gastrointestinal in nature, holding that high index of suspicion given her history of recent travel from Europe and also the pulmonary infiltrates, I held the discontinue contact precautions, respiratory isolation precautions order, and trusted my gut on this one and got the COVID antibody test on her. And sure enough, it was positive. And so then she went on to the COVID service. So the exposure, there probably wasn't an exposure because of the PPE that was available and how there was no break in the order to keep her on respiratory isolation. And of course, though, within 2 days, I started developing a sore throat. What I find interesting is that in the past, as physicians, having a sore throat or a runny nose, no problem. We wouldn't have thought twice about going to work. And now, if we have any sort of upper respiratory symptoms or anything at all that might signal the possibility of COVID-19 infection, it behooves us to try to make sure that we don't have COVID at the very slightest sniffle. So I think that there's this paradigm shift of healthcare professional well-being that is being addressed Perhaps not in an ideal way, but it is definitely getting magnified.
So when you had this patient who previously tested twice with a negative PCR, and then all of a sudden discovered that she was positive and you were treating this patient in a non-COVID service, what exactly was going through your mind at that moment?
That I kind of expected it,
Hmm.
that of course she would test positive. It just goes to show that the PCR isn't super accurate
Hmm.
in settings where the primary symptoms is initially the presenting symptoms were GI related. And so there's something to be said about clinical intuition and
Hmm.
the limitations of science and technology.
Now, I think the story that you tell, healthcare workers across the country are dealing with that same uncertainty. Did I get exposed? Was I wearing PPE properly? Are the symptoms that the patients are showing, is that COVID or not? Now, from your experience and what you've learned over the past year, what are some techniques that you could recommend these physicians take to help address and handle this uncertainty that they're feeling?
One is dealing with stress or uncertainty or some anxiety provoking situation. I like to resort to some of my handy mindful acronyms. The RAIN practice has since been made popular again by Tara Brach, who is a world renowned mindfulness teacher and psychologist. So R stands for recognize the uncertainty, the stress, or the anxiety. A is to allow and accept that particular situation in the present moment, just as it is, without trying to resist it. I is to investigate. So being curious about what you're feeling from an emotional standpoint, as well as naming your body sensations. Oftentimes we're so in our heads making thousands and thousands of decisions in our clinical work days that we forget to check in with our bodies. And then N is for not taking it personally and then nurturing yourself. So reminding yourself that that particular stressful situation is probably not going to be a defining moment for you as a human being, and that really that situation is not personal and usually is not a direct attack on your humanity. And then N is to ask yourself, what do I need in that moment to help myself, to serve myself? What is it that I need in that moment for kindness?
So when you had this potential exposure, and healthcare workers across the country, they always have potential exposures. Now, what kind of support services did you have? Did you have anyone to talk to really help support you during this time of uncertainty?
Yeah, so our employee assistance program and our chief medical officer have been very accessible and transparent with what to do in this situation, because I'm sure it happens multiple times a day. And now on my fourth COVID test during the pandemic, it's becoming more commonplace. And so I was able to contact a specific triage line made for physicians with a potential exposure, and then basically get fast tracked into a drive-through testing facility
Hmm.
within 12 hours of the sore throat onset. And so it's been really streamlined, a lot more streamlined than I would say my first COVID test back in March.
We're talking to Ni-Cheng Liang. She is a pulmonary physician, and she wrote the Kevin MD article, A Physician Waits in Uncertainty. Ni-Cheng, this is the third time that we've been together on this podcast, and each time we're at a different point of the pandemic. And we're now speaking in the middle of February. Now, has anything surprised you in the evolution of the pandemic?
What has surprised me has been the pathophysiology of COVID. I think we are much better at treating it. In my hospital, I sense from the outpatients that I do see from all walks of life that the mortality is decreasing because physicians are getting better at treating it.
Hmm.
And we have available drugs that are now FDA approved. So I think that the rapidity in which the development of treatments and also the vaccine development has been surprising. And yet, despite the vaccines being more available, now almost a year into the pandemic, I kind of expected that at least the first 6 months of 2021 was going to look very similar to 2020 because of the vaccine distribution not being as effective in getting a vast majority of the population vaccinated However, that being said, though, it is significantly increasing, and vaccine superstations are opening up everywhere now in San Diego County. And so that's been a pleasant surprise to see that ramp up at much higher rates over the last few weeks.
And hopefully, when I have you on next time on the podcast, we'll be in a better place than we are now as it relates to the pandemic.
I hope so, Kevin.
So, my final question, what's your take home message that you want to leave with the Kevin MD audience?
My take home message is to expect the uncertain and that it's okay for there to be uncertainty. So, my invitation for all of you is, can you sit with the uncertainty of COVID and use that as an opportunity to look within and ask yourself, what is it that I need in this moment?
Ni-Cheng, thanks again for returning to the show. Best wishes on your podcast. And thanks again for your time and insight.
Thanks for having me, Kevin.